Hello, good afternoon, everybody. Welcome to the session on Destination 4 of Health Cluster, where we discuss, in particular, the topics that will be funded under this destination in the year 2021. My name is Carmen La Plaza, and I am the head of unit of the Health Innovations and Ecosystems unit in the research, and I will be introducing this session that will be afterwards continued by my colleague, Per Reiner, who is the destination leader of Destination 4, and the different topic leaders that are behind the topics that will be funded in 2021. So before starting, let me mention that the main objective of the session is to answer questions that you might have on the topics to be funded in 2001. And for that, I invite you to upload your questions in the slide that you can see in the screen so that we can tackle them one by one when we start addressing your questions. So let me maybe introduce on this destination that has the overall goal to ensure access to innovative, sustainable and high-quality healthcare services with the support of the research and innovation actions targeted to this goal. These activities will build on activities that were funded in previous framework programs, and more specifically in actions supporting the domains of health systems and public health. Healthcare systems are affected by limitations in their sustainability and resilience, and these challenges have been really put into light and reinforced through the COVID crisis that has revealed inequalities in the access to high-quality healthcare service in Europe. Destination 4 and the research and innovation topics in the context of this destination will address the transformation and modernization of our healthcare systems by taking advantage in particular of digital and data-driven innovation to make sure that our health systems are more flexible and equitable. So activities funded under this destination should help healthcare systems, European healthcare systems, becoming more effective, more efficient, accessible, fiscally and environmentally sustainable, and equally resilient in order to cope with public health emergencies. There is a video that you can find in the website of the Info Day where you will find more details around this destination and also around the specific topics that will be funded in 2021. And let me also maybe put the finger on the increased emphasis that Horizon Europe is putting in the achievement of impact. So it is important that you keep in mind when preparing proposals that with your proposals that you are going to deliver, achieve a specific outputs, and that it's important to keep in mind who will be the users of the specific outputs, because thanks to the use by those users of whatever comes out as a result of your project, we will be able to achieve the expected outcomes that are tabled in the destination and that in the long term should contribute to the expected impacts that are described in the introduction to the destination. So now I will pass the floor to Bernd Reiner, the destination leader, who will moderate this session. Bernd, the floor is with you. Thank you.
Thank you very much, Carmen, for this introduction. And hello, everybody who is listening and looking at this session on Destination 4. I would like just to add on a bit of information on the topics under this Destination 4, the topics which are already open now for submission of proposals for the Work Program 2021. They are in principle driven by the key impact of this destination, which is to make the European healthcare systems to provide equal access to innovative, sustainable and high quality healthcare, thanks to the development and uptake of safe, cost-effective, and people-centered solutions, with a focus on population health, health systems resilience, as well as improved evidence-based health policies. In order to achieve this long-term goal, a sort of programmatic approach has been chosen, and for Work Program 2021, the emphasis has been laid on 3 items. First, the improvement of quality healthcare along the entire healthcare continuum and putting the patient at the center. Then, the better use of digital and data-driven tools for supporting health decisions. And the third one, initiating the enhancement of the uptake of innovative healthcare services and health technologies. And this has been translated through the 3 topics, which you can see here on the screen. The first one, enhancing quality of care and patient safety with a deadline of the 21st of September. The instrument is a research and innovation action, and a total budget of 25 million euros has been reserved for actions to be supported under that topic. The second one, data-driven decision support tools for better healthcare delivery and policy making with a focus on cancer. Same deadline, also area, total budget for the actions to be supported here, 40 million euros. And the last one is the Healthcare Innovation Procurement Network. This is a CSA, so a coordination and support action, which is designed to be a sort of an initiating point, a starter for later actions with regard to healthcare innovation procurement. This was more or less what I wanted to say up front. I hope that you have looked to the video in order to see the expected outcomes which are expected from the actions which are going to be funded under these topics. And I would now open the floor for questions. Thanks. The first one is on topic 1, 0501. Have there already been EU-funded initiative in this domain? I would like to pass this question to my colleague Jean-Luc.
Thank you, Ben. I understand this question because in the topic we recommend that the proposals alliance with other initiatives, EU initiatives, and actually we have not named any initiative. It's open, so it's not something that is that we want the proposals to alliance with a dedicated initiative, but we want them to have an idea about possibilities of synergies and cooperation with other groups. Thank you.
Thanks, Jean-Luc. Another question. 0504. So this is a question on the CSA. How does this call relate to existing networks and communities of practices such as URIFI? I would like to pass this question to my colleague Orestes, if he's there.
Thank you, Bernd. Yes, I am. I hope you can hear me.
Yes.
So So EURIFI is one of the two CSAs that were among the last calls we ran in Horizon 2020 related for innovation procurement, the other one being PIPPI. And while we do not see this CSA, the Innovation Procurement Network, as a direct continuation of these calls, and I will explain why, I would like to advise potential applicants to take into account these two initiatives. So this is a valid question. And how? First of all, partners or groups related into these two CSAs can, of course, participate as applicants in the new CSA, if, of course, the conditions of Horizon Europe related to CSAs are met. That's one thing. And I'm quite sure that their experience and knowledge could bring something into a potential proposal. Then a second way could be that, of course, during a proposal preparation stage, there is a horizon scanning by potential applicants. So they do see what activities past or current were there before they did the proposal, while they shape their plan, their approach, and their methodology in order to avoid the duplication of work and build on those activities. So I do suggest that this is this scanning and these initiatives are taken into account by any potential applicants. And then finally, one will see, well, if you read the text of our call, that some basic elements of this CSA is procurers reaching a common understanding on what the challenges are and what the available approaches and instruments and tools are to do innovation procurement in Europe, at European and at national level. It foresees capacity building activities to which this prior knowledge can be an advantage. It also foresees knowledge transfer, for example, twinning. Now, one can see how previous activities in the area could contribute to a successful proposal like that. But I would like to close a bit this long statement by saying that this CSA is not focused only on European activities such as EURIFI or PP. It is about any knowledge, experience, and best practice we have at the national level currently in Europe, or at European level, or at local level. So please be holistic in your approach as you prepare proposals.
Thanks a lot, Orestes, for this really comprehensive answer and touching already on some other issues on this topic. Now, question 50501, what is meant by patient-centered? Well, maybe I can already start to answer here. Patient-centered and patient-centric is a general objective in the move from I would call it somehow the macro approach, the disease approach, to a real person-centered approach. This is a general guideline which is running across the entire health cluster. So this is not only a special feature of this topic 0501. This is something which goes across the entire health cluster as a whole. But Jean-Luc, please come in if you want to add something.
Yes, I think it's a general approach of the personalized medicine, but it's requested in this topic. So they need to have an approach which is patient-centered. And there are specifications in the topic regarding patient reports. So I think it's in the second part where we mentioned explicitly patient report outcome measures and patient report experience measures. So we definitely expect proposals to involve patients and take into account their voice. The second element is that when you consider safety, you could consider one thing, like, for example, nosocomial infection, you would concentrate on hygienic measures. But you can also see from the patient point of view, identify patient at risk of getting this. So it's a different approach that we would like to implement. Thank you.
Thanks, Jean-Luc. Then I see 05, 01, and 02. For them, a clinical annex is not required. Does it mean that clinical studies are not recommended for this topic? If I, when I look to the topics I would say that clinical trials are maybe not the primary target or the core of these topics, since we are here in more the domain where we address more the health systems, the processes and the procedures. But I let again Jean-Luc complement, please.
Yes, I'm sorry because I lost the mouse, so now I have to use the pad. Actually, for this topic, we were not thinking about clinical trials, but it's not about clinical trials, but it's not forbidden. But it has to make sense. So it's to the applicant to estimate whether the need or not. They may need clinical trials in the sense that we say that we could expect to have pilots available for healthcare givers. So that could mean that in a certain sense, they could try a clinical trial. So it's not forbidden, but it's not the major thing we had in mind.
Yeah. Thanks, Jean-Luc. Yes, that's what, and the same holds true for topic 0502. Eventually, the next one is the focus of 0502. So the data-driven topic solely on cancer, or would mental health be considered? No, here the focus of this topic here under 2021 is really on cancer. It may be seen that maybe for future work programs, there would be an opening for another therapeutic area or disease area. This remains to be seen. Next one, again on 0501, enhancing quality of care and patient safety. Can the proposal be focused on a specific medical area or disease? This is a good question. I would say so. It is possible to focus on one specific therapeutic area, but it is not a necessity. Maybe it is then very focused, but I leave again to Jean-Luc to complement here.
Yes, I confirm that in fact it can be focused in a specific disease area if there is a specific problem linked to this disease. But when the topic was written, it was more an holistic approach that we had in mind. So again, everything you choose has to be justified, but there is no reason why you would not concentrate on a specific disease, although it was not our initial intention.
Yeah, thanks. Yes, thanks, Jean-Luc. That's also how I understood it. So I cannot see now additional questions. Maybe to use the time eventually to go a bit to remind you of the importance of the expected outcomes which are mentioned under the topic descriptions. These should be the driving principles of all the work which is proposed by the applicant consortia, and under this destination, it is so that really I would say, all the user groups which are involved in the healthcare continuum are to be the users of the outputs of the research work. So it is for most topics the health, or specifically for the topics which are on improving the decision support system and providing decision support tools. It's very much for health policy makers that they are enabled to use specific evidence for developing affordable and safe interventions. It is for the healthcare professionals that should, in partnership with empowered patients, apply harmonized procedures and guidelines securing patient safety, very relevant for the first topic. Then for healthcare providers to integrate standardized practices with personalized treatment schemes and use quality assured processes along patients' clinical pathways, and also to ensure that more and more healthcare professionals and patients or citizens at large adhere to recommendations which are relevant for safety. These are outcomes which are relevant, especially for the first topic. When we look to the second topic, there the main users are supposed to be healthcare organizations and policymakers, to equip them with modeling and other IT solutions in order to facilitate their decision-making on health interventions, as well as healthcare providers and citizens, also in their decision-making process for interventions, and to provide health system owners with evidence-based and participative tools that take into account all relevant aspects for the delivery of adequate services to patients. And last but not least, to give access for policymakers the access to evidence-based and interoperable decision support tools when they take their decisions, which are then decisive for the health systems. This was more or less topic 2. And topic 3, the CSA is, of course, important to be looked at also in the context with the EU for Health program. There will be necessary to have a close interaction with our sister DG, DG Santé, because this network is, as Orestes said already, it will be crucial to involve all the national actors and or even local actors which are to procure in the end health innovations. Do we in the meantime have maybe another question or? Okay, apparently not.
Yes, Bernd.
Yes.
There are
yes. Okay, good. Question related to 0502. The solutions to be developed should reach a specific technology readiness level. How close to the market should be? In general, I have to say that in the health cluster, due to the specificity of health technologies, we have technology readiness levels to be achieved only mentioned in exceptional cases. If there is a clear technology targeted, then this is mentioned. Normally, this is not the case. So that's why in this topic, there is no such thing as a specific technology readiness level targeted. In principle, the goal is to come up with these digital and data-driven tools, which should help to enhance and to improve the decisions for both the patient, the healthcare provider, and also the policymaker. Next question, 0502 again. The dynamic relations with initiatives and areas is required at proposal level, or will it be defined later on? European Health Data Space still on preparation. This is a good question. I think so that the actions supported under this topic, they will have to propose or to describe in their annex, in their work, how they are going to interact with other initiatives and actions who will be also strongly based on health data. And the European Health Data Space is certainly a very important initiative in this respect. But I don't know if eventually, Carmen, you would like to add something on that.
Well, actually, I think that we cannot provide a very concrete answer to the question, because everything would depend on the specific content of the proposal, of the work to be done by the proposal. Of course, there are different initiatives fostering the building of a European health data space, and these initiatives are of different and diverse nature and will in different steps of maturity. So it is absolutely understandable that there is no a fixed and concrete legal base in which in this ground yet. So I think that what you provided as an answer is appropriate in the sense that it is requested that the proposers would be actively interacting with the relevant initiatives in the field of the European health data space, but also in any other relevant initiatives, for example, also in the context of cancer. So political priorities, political development, relevant initiatives would be to somehow be interacted with. But on the concreteness, that will depend on the specific focus of each of the proposals.
Thanks, Carmen. Yes, what else do we have? 0504, should the CSA include procurers and providers? To my understanding, yes, but please, Orestes, correct me if I say something wrong.
Sorry for the sound you're going to hear. There is a plane passing by. So I will wait a few seconds before I start my answer, if this is okay with you. And I think I have seen at some point, and then it disappeared, another question regarding the 0504, which was asking us to explain what we mean by saying that a proposal should engage stakeholders in an appropriate way. And I think this is more or less a connected question to this one as well. So I'll try to answer both if this is not a problem. So I would like to remind our audience that this topic, it is quite clearly stated at its beginning, focuses on public and private procurers. So we would like it to be driven by the demand side. And we do provide examples of potential other stakeholders who could participate, such as innovation competence centers or health authorities, in the sense that we want to point applicants to having a complete consortium which can actually help procurers carry out the activities and reach the expected outcomes we want for the demand side. We now do recognize that the expected outcomes for these topics cannot be achieved without consultation and engagement with several other types of stakeholders, like patients, for example, like the industry, indeed, so providers such as SMEs, like policymakers not involved in the project, or like investors. And hence, we do require applicants to engage them in an appropriate way. What does this mean? It means decide at which level they need to be involved in order for the project to achieve its targets. Should they be partners? Should they be third parties? Should they be consulted through the open market consultation, which you will find somewhere in the call topic as a requirement? Or should they participate in the training and capacity building activities? Now, this is up to the applicants to decide who can take part. Of course, the participation of suppliers or SMEs is okay for the eligibility of a proposal. Like in every other CSA, everyone who is eligible to participate in a CSA can participate in this one. But I call for applicants to read well the topic and see all these actors at which levels they should participate in a future project, let's say.
Mm-hmm. Thank you very much, Orestes. Yes. I see there is another question related to 0501 and 0502. Would enhancing and systemizing patient records in a clinical setting satisfy the requirements of these topics? I would a priori say this is probably not sufficient. It can certainly be an element, but I would say that this, if this would be the only task or main action to be performed for these topics, I think this would probably not suffice. But please, eventually, Jean-Luc, if you would like to add something here for 0501 also.
Yes, well, I confirm. I mean, this would be very restrictive in my opinion, and it can be probably a tool to achieve the objectives of the topic, but it seems to be quite restrictive.
I would say the same is true again for 0502. I think that just enhancing eventually patient records, electronic health records through a clinical setting in a clinical procedure, I think it would certainly not be sufficient for fulfilling the requirements or the scope described under this topic. Then I see the next question. I think we have already answered the next one for 0501 specific medical area. This we had already. Yeah, there is one, the first one, yes. The proposal 01. Does this topic address only solutions interventions in hospital primary care or also secondary care? To my understanding here, this is not restricted only to primary care. It could well, of course, include also secondary care. But Jean-Luc, again, could you confirm?
Yes, you're right. To a certain extent, it's written in the topic when you look closely. It says that there is a focus on development and piloting of harmonized evidence-based intervention. And it says the issue should be addressed in case studies at hospital, primary, and outpatient care levels. So I think it's it answers the question of the secondary care. Over.
Thanks. Thank you. Do we have some additional questions? If not, I don't know how long actually we still have to talk about the topics here under this destination. I don't know if there could be still something be said on the CSA for the Innovation Procurement Network. Eventually, maybe Orestes, could you give maybe a few more sentences or a bit more insight that this is only a starting point and that there is very likely more to follow?
Sorry, Bernd, I didn't quite catch that last comment of yours.
I just thought to use the time to say a few words about the fact that the CSA is somehow building on what has been done already in previous frameworks. But here on the Horizon Europe, it's a starting point for eventual deeper actions to follow then in future work programs.
Yes, indeed. So I would like to put it this way to address once more maybe the question we had before. We do see this topic as being a few steps more ambitious than previous topics we had called for in Horizon 2020, but not necessarily a direct continuation of those. And that is why, and that's because we expanded the scope of this topic. We are aiming at a healthy group of and balanced group of procurers who are willing to cooperate, who are willing to identify common needs and challenges, who are willing to work together to systematize the way we do innovation procurement in Europe, irrespective of instruments, without a focus on, for example, usual instruments we see in Horizon Europe, such as the PCP PPI. Of course, they are very welcome to do that if they find that these are the instruments of their choice, for example. But also, we have the SPIRs, we have the innovation partnerships, we have direct procurement, we have several sorts to procure innovation, actually. So we want them to analyze these tools, to systematize the way they do procurement, and to collaborate together at a larger scale, hoping that they can plan future activities in the area. And that is how the topic is way more ambitious, I would say, as before. But at the same time, we didn't try to prescribe a lot what a proposal should look like. We have foreseen a minimum number of requirements and tools that need to be there in order to achieve the objectives of such a well-funded topic, I would say. But we do expect procurers actually to share with us their experience and their approach of how it should look like, especially after COVID, where I think we have to reimagine a bit the way we do things, and we have to assess what the changes were, especially for those who not only procure, because almost everybody in the health sector procures this way or the other, but those who need to procure innovation, and they need it fast. And sometimes this is not so easy as the pandemic showed us.
Thank you very much, Orestes. Yes, for these additional remarks. I just would like to ask if there are eventually new questions which have popped up or not. Apparently not. So if there are no more questions, I would like to thank you very much to the audience and also to my colleagues for helping here to answer those questions. And I would like to give now the floor to Carmen again, eventually to make some closing remarks.
Thank you, Bernd. I would like to maybe reinforce what was just said on the innovation procurement topic. On top of what Orestes said, I would just like to reinforce the importance of the widening. One of the things that we would like to achieve with this coordination and support action is precisely that actors that will be interested in launching themselves in this adventure of experimenting, learning in innovation procurement, that have the opportunity also to do it together with other actors which have already got some experience. So the widening effect is very important, and also because the main aim of this is in the context of the transformation of the healthcare systems, so perfectly fits this destination. What we want is to embed innovation in the provision of healthcare. And that's why we think it's important to build capacities and not specifically to build them only to answer to pre-commercial procurement or public procurement for innovation topics funded by the European Commission, as Orestes said, building capacities in general to be able to introduce the procurement of innovation in an easier way. So that's, I would say, just to complement, the widening impact is very important. So I think that it's time to close the session. As Bernd said, thank you to everybody. Thank you for our audience, for your interaction and questions and interest. Thank you to the speakers, to the different topic leaders that supported us in the organization of this session. And let me remind that the session is recorded. You will be able to access later on, and that the questions will be uploaded also in the frequently asked questions in our website. And now, please stay with us if you are interested to learn more or to ask questions about the topics that will be funding in Destination 5 and 6. You just need to close this Zoom meeting and enter into the new one in order to follow up Destination 5 session that will start at 15:15. Thank you very much, and hopefully see you later.